Dr. Ulysses Jackson. Okay, back with the second part of us explaining the difference between a motivational speech and therapy. Again, as I said in the first part, motivational speaking is a call to action. It's calling you to do something. Let's get up and do this. Let's get up and do this. Get motivated. Let's jump up. Let's stretch. Let's walk. Let's exercise. It does exactly what it says it's supposed to do. Motivate you. Motivational speeches. Therapy, on the other hand, is a way to help you diagnose a specific mental disorder. You know, another thing with motivational speaking is that when someone comes on and they say, I was there and get up and go do this and go do that. As I said in my other part, I love it. People have helped me. I have got from A to B with it. But when you're severely depressed or have persistent depression or social anxiety or a specific phobia, you're going to need more than motivation. You may need even medication, which I'm not an MD or a Psych D. You know, I'm a licensed mental health counselor that's going to help diagnose the levels of your mental diagnosis, whether it's trauma, whether it's anxiety, or whether it's depression. We're going to get into what those all mean. So again, motivation therapy or motivational speaking versus therapy. Again, it says psychotherapy, it helps a person identify certain problems and mental disorders and emotional thoughts that affect their daily living. So what does that mean? I've never seen a motivational speaker give a diagnosis. So let's get into that. What we do, what mental health counselors do, licensed clinical social workers, psychologists, psychiatrists. We go into a diagnosis, which is a mental illness related to a medical condition. Examples are those of depression, depressive symptoms. The MD could even go into thyroids, which could change your emotional and your mental state. Motivational speaker ain't doing that. He's doing what he motivates you, call to action. And there's millions of us that need that call of action. But then it's another million of us that's going to need that plus therapy. That's what we call as joint therapy or joint work or a multiple disciplinary team. You may have been depressed and might have to get that motivation to get up and get to the gym. Get up and take them walks. Therefore, mental health diagnosis involves a full evaluation. There is no motivational speaker giving you a full diagnosis or full evaluation. A physical exam that includes blood work, they're not giving that. Some of the common diagnoses for mental health issues are your anxiety, your bipolar, your depression, PTSD, post-traumatic stress, schizophrenia, eating disorder, disruptive behavior with children, and development disorders. This is what is the difference between counseling and therapy and motivational speaking. So I just didn't want some of the people that I cared about to get up in the morning and feel like they're going to click the button and go to this motivational speaker and they're going to take care of that depressed state that you're in now. And again, with a motivational speaker, they tell you all about them and the great things that they've done. It's not about me. It's about you. Where's the chance that you get to say, this is why I don't get out, or this is why I don't get up? So also the difference is that the motivational speaker is going to tell you everything that they've done to get to where they got to be. Therapy is going to listen to you. What's up with you? How's your day going? How does your night go? What makes you tick? You know? And if a therapist tells you something about themselves, it's supposed to be on a limited basis, because self-disclosure is another issue in therapy where when you talk too much about yourself. You know what I'm saying? Again, it's not about me. And a motivational speaker gives you stories of how they went from A to B, which is beautiful, which is what some of us need. But understand and do not get it confused that your favorite daily motivational speaker is motivating you. It's a call to action. In therapy, it's about you and how you got in that situation. So this is Dr. Ulysses Jackson breaking down the difference between daily motivational speeches and therapy. This is an informational series that I'm giving you. This is not therapy. Dr. Ulysses Jackson.